This is Session 3, an overview of breast cancer. This session will cover breast cancer. By the end of the session, we will cover the anatomy of the breast, what breast cancer is, what is the burden of breast cancer, and what are the risk factors for getting breast cancer. What are the symptoms of breast cancer, types of breast cancer screening test, questions you should ask your doctor, and the treatment options available for breast cancer. The female breast is made up mainly of lobules, ducts, and stroma. Lobules are milk-producing glands in the breast. This is where lobular carcinoma occurs. Ducts are the tiny tubes that carry milk from the lobules to the nipple. This is where ductal carcinoma occurs. Stroma is the fatty tissue and connective tissue surrounding the ducts, lobules, blood vessels, and lymphatic vessels. Question: can breast cancer occur in the stroma? Answer: yes. Breast cancer can occur in the stroma, but is less common than lobular or ductal carcinoma. These images show the anatomy of the breast. The image on the left shows lymph nodes where cancer may also begin, as well as the mammary gland and nipple of the breast. The image on the right shows the lobules and ducts, where the most common types of breast cancer occur. It also shows where subcutaneous fat, the areola, and the nipple are located. Breast cancer begins when cells in the breast are not growing normally. There are different types of breast cancer, and some types are more common than others. The most common type is called ductal carcinoma. This type starts in the milk ducts in the breast. The other common type of breast cancer is lobular carcinoma, and this type of breast cancer starts in the lobes of the breast. Carcinoma in situ is a type of cancer where the breast cancer is still only located in the original site of the breast and has not spread. For example, ductal carcinoma in situ is when there are cancer cells only in the milk duct lining. However, invasive carcinoma is when the cancer has spread to other locations beyond the original site. For example, invasive ductal carcinoma is when the cancer cells have spread to other areas of breast tissue and can also spread to other parts of the body. As with ductal carcinoma, there can be lobular carcinoma in situ and invasive lobular carcinoma. After skin cancer, breast cancer is the most common type of cancer among women in the United States. Each year in the United States, more than 246,660 women are diagnosed with breast cancer. Also, about 2,600 men in the United States are diagnosed with breast cancer every year. In Maryland, there were over 4,000 new cases of breast cancer in 2011. In the same year, there were 786 deaths from breast cancer in Maryland. The chance of having an invasive breast cancer during a woman's lifetime is less than 1 in 8. Also, the chance of dying from breast cancer during a woman's lifetime is 1 in 37. As of now, there is no known cause for breast cancer. However, there are certain risk factors that may raise a woman's risk for getting breast cancer. One risk factor is age. The chance of getting breast cancer increases as you get older. Also, your personal health history can be another risk factor. Having breast cancer in one breast increases your risk of getting cancer in your other breast. Another risk factor is your family health history, as your risk for breast cancer is higher if your mother, father, sister, or daughter had breast cancer. Having radiation therapy to the chest before the age of 30 also increases a woman's risk of breast cancer. Women who use oral contraceptives also have a higher risk of getting breast cancer. There are several risk factors that fall under a woman's reproductive and menstrual history. The older a woman is when she has her first child, the higher her chance is of getting breast cancer. Also, women who have never had any children have a higher risk of getting breast cancer. Women who had their first menstrual period before age 12 are also at an increased risk of getting breast cancer. In addition, women who went through menopause after age 55 are at an increased risk of getting breast cancer. Lastly, women who take menstrual hormone therapy for many years are at an increased risk of getting breast cancer. Women who are overweight or obese after menopause have an increased risk of getting breast cancer. In the United States, breast cancer is diagnosed more often in white women. Women who are not physically active have a higher risk of getting breast cancer. And lastly, women who drink alcohol have an increased risk of getting breast cancer. Breast cancer in its early stages usually doesn't cause symptoms. However, as the tumor grows, it can change how the breast looks or feels. Some common changes include a lump or thickening in or near the breast or in the underarm area, a change in the size or shape of the breast, dimpling or puckering in the skin of the breast. Some common changes include a nipple turned inward into the breast, discharge or fluid from the nipple, especially if it is bloody, and lastly, scaly, red, or swollen skin on the breast, nipple, or areola. This image shows the early warning signs of breast cancer. Starting with the left uppermost image, the images show the different types of symptoms, including a lump, pulled-in nipple, dimpling, dripping, a rash or redness, and skin changes. If any of these changes are seen, a woman should see their doctor immediately. Screening means looking for signs of disease even if a woman doesn't have any symptoms. With breast cancer and other cancers, screening is looking for disease at an early stage and when treatment may work better. So that people are able to find cancer early, giving them a better chance of treatment working well, we recommend following the screening guidelines set by the American Cancer Society and other organizations. A mammogram is a screening test to find breast cancer early. It is an X-ray picture of the tissue inside the breast. If you are 40 to 44 years old, you should talk to your doctor about having a yearly mammogram. If you are 45 to 54 years old, you should be getting yearly mammograms. If you are 55 years and older, you should talk to your doctor about getting a mammogram yearly or every other year. Mammograms can often show a breast lump before it can be felt. If a lump is found, further tests are needed to find out if abnormal cells are present. Here are some questions that you should ask your doctor to discuss breast cancer. Some questions include, what is breast cancer? What kind of screening would be best for me? How often will I need to be screened? More questions include what is involved in the screening and how do I prepare for screenings? Again, here are some further questions to ask the doctor, including, can I drive after the exam? Is there any risk involved with screening? When will I get the results? Here are some more questions to ask the doctor, including, how much will my screening cost? If breast cancer is detected, there are several types of treatment. The types include surgery, radiation therapy, hormone therapy, chemotherapy, and targeted therapy. The next several slides will discuss the treatment options. Surgery is the most common treatment for breast cancer. There are two common types of surgery: breast-sparing surgery and mastectomy. The image shows a modified radical mastectomy where the breast and lymph nodes are removed. A breast-sparing surgery removes the cancer but not the breast. It can be a lumpectomy or a segmental mastectomy. The image shows a lumpectomy and how the lump and surrounding tissue are removed. As seen in the previous photo, a lumpectomy removes just the lump in the breast and the surrounding tissue. A segmental mastectomy or partial mastectomy is similar to a lumpectomy, except more breast tissue is removed. A mastectomy is an operation that removes the entire breast or as much breast tissue as possible. In some cases, a skin-sparing mastectomy may be an option. For this surgery, the surgeon removes as little skin as possible. In this image, an adult female is shown after a mastectomy where the entire breast was removed. Radiation therapy is another method used to treat breast cancer. Radiation therapy uses high energy rays to kill cancer cells. It affects only the cells in the part of the body being treated. There are two types of radiation therapy. The first type is external radiation therapy. This is the most common type of radiation therapy. For external radiation therapy, the radiation comes from a large machine outside the body. The other type is internal radiation therapy. This therapy is less common than external radiation therapy. Internal radiation therapy uses a small tube that is placed inside the breast. The tube has a radioactive substance in it that kills the surrounding cancer cells. Hormone therapy is another type of breast cancer treatment. It is sometimes called anti-hormone therapy. If a lab test shows that the tumor in the breast has hormone receptors, hormone therapy may be an option. Hormone receptors in cells allow hormones to join with the cell and make changes to the cell. While these are normally okay for the cell, in breast cancer, it can cause the tumor to grow larger. Hormone therapy keeps cancer cells from getting or using the natural hormones they need to grow. These natural hormones are estrogen and progesterone. Chemotherapy, another type of breast cancer treatment. Chemotherapy uses drugs to kill cancer cells. The drugs that treat breast cancer are usually given through a vein or as a pill. You will probably receive a combination of drugs. Chemotherapy can be given in the hospital, at the doctor's office, or at home. It usually depends on the type of chemotherapy given and the individual needs of the patient. Targeted therapy is the last type of breast cancer treatment we will cover. Some women receive drugs called targeted therapy. This treatment uses drugs that block the growth of breast cancer cells. For example, targeted therapy may block the action of an abnormal protein that stimulates the growth of breast cancer cells. This is similar to hormone therapy in that it tries to target the specific molecule that is causing the tumor to grow. Now we will address some common breast cancer myths. The first breast cancer myth is finding a lump in your breast means you have breast cancer. However, if you find a lump in your breast or any changes in your breast tissue, it is important that you see your doctor right away. 8 out of 10 breast lumps are benign and not cancerous. The next myth is the only sign of breast cancer is lumps. What are the other signs of breast cancer? The other signs of breast cancer includes nipple pain or retraction, redness or scaliness of the breast skin or nipple, skin dimpling or irritation, or a discharge that is not breast milk. Another common myth is that a breast injury can turn into breast cancer. However, there is no evidence that bruising your breasts can lead to cancer. Also, the belief that men do not get breast cancer is another common myth. Question: can men get breast cancer? I heard that only women get breast cancer. Answer: while women get cancer more often than men, approximately 2,000 men will be diagnosed with breast cancer every year. Men should still give themselves regular breast self-exams and tell their doctor if they find any changes. Many believe that getting a mammogram can cause breast cancer to spread. However, this is just a myth, and a mammogram is one of the best ways to detect breast cancer. It cannot cause cancer to spread, and the pressure on the breasts cannot cause cancer to spread. Here are some more common breast cancer myths. Many people think that mammography is 100% accurate or mammography is useless. In reality, mammography will detect 80 to 90% of breast cancer cases in women without symptoms. Some women think that they are too young to get breast cancer. Breast cancer can occur in women of any age. While it is most common in postmenopausal women, 25% of women with breast cancer are younger than 50. Another myth is having a family history of cancer means you will get it. Question: but I thought that because my mother had breast cancer, I would definitely get breast cancer. Answer: while women that have a family history of breast cancer have a higher chance of getting breast cancer, most women who have breast cancer do not have a family history. Another myth is that breast cancer is contagious, but breast cancer is not contagious. It is not possible to give breast cancer to someone else or get breast cancer from someone else. Many women believe that antiperspirants and deodorants cause breast cancer. However, researchers have not found evidence that deodorants or antiperspirants can cause breast cancer. Another myth is that there is nothing a woman can do to lower her risk of getting breast cancer. Question: what can lower my risk of getting breast cancer? Answer: while many factors that can increase your chance of getting breast cancer cannot be changed, such as family history, genetics, and your age, there are things that you can do to lower your risk. This includes controlling your weight, being physically active, and not drinking alcohol. Many women think that if they eat a healthy diet, they will be immune to breast cancer. However, while eating a healthy diet can reduce your risk of getting breast cancer, it cannot make you immune to breast cancer. The last myth is that dietary supplements and herbal remedies can help to treat breast cancer. But there are no dietary supplements or herbal remedies that have been found to treat breast cancer. Here are some take-home points from this session. First, breast cancer begins when the cells in the breast are not growing normally. Also, there are two common types of breast cancer. The first type is ductal carcinoma, where the cancer begins in the ducts of the breast. The second type is lobular carcinoma, where the cancer begins in the lobes of the breast. Currently, we do not yet know the cause for breast cancer. However, scientists are trying to identify the causes. There are several risk factors that we know can increase your risk for breast cancer. Some of these include a family history of breast cancer, your age, a history of taking oral contraceptives, and a lack of physical activity. There are some early warning signs of breast cancer, including dimpling of the breast and a change in the size or shape of the breast. Any symptoms should be reported to your doctor immediately. Screening can help to detect cancer in its early stages. For breast cancer, this includes self-breast examinations, clinical breast examinations, mammograms, and MRIs. If breast cancer is found, there are many different types of treatment. These include chemotherapy, surgery, and radiation therapy. Thank you.